people come in the office, they typically don't know why they have the problem on the bottom of their foot or in their heel. It's caused from an overstrain of the ligament called the plantar fascia on the bottom of the foot. When it gets overstrained, you start to get a breakdown in the tissue there, which your body then tries to tighten up so it can heal. And then the result of that is that you feel a tightness or a restriction in the bottom of your heel every time you get up from a seated position, a lying down position at night. And it goes through the process of basically tearing apart the tissue so you can loosen it up and get going with your day. Unfortunately, that loosening up process is continuing to do damage to the plantar fascia or the ligament, and so it becomes a problem that typically just continues day in, day out. Most of the time when we see patients, they've had it for months already. Maybe it was getting a little bit better, they decreased the pressure to the bottom of their foot, and then they did some yard work, mowed the grass, did some work around the house, some cleaning, and here it is again. And that's usually when we see them after several months of that. As far as diagnosis is concerned, we have an ultrasound machine in the office that allows us to look at the soft tissue themselves inside the foot. Again, X-ray is not going to tell you whether or not you have plantar fasciitis. The ultrasound will. So we use that to diagnose, and then we also start discussing stretching and strengthening exercises to prevent it from returning. Very infrequently do we have to release the band or actually do heel surgery. In fact, I would say over the past several years, I've maybe done 2 or 3 heel surgeries, seeing 50 patients a week with heel pain. You do not have to live with heel pain. Heel pain can be treated 100%. People come into the office, we can provide solutions to allow them to walk pain-free.